Quality standards outline for clinicians and patients what quality care looks like. They focus on conditions or topics where there are large variations in how care is delivered, or where there are gaps between the care provided and the care patient should receive. This presentation endures to discuss what roles do standards and frameworks play in improving healthcare quality and how to achieve quality certification and accreditation. Hello and welcome. I'm pleased to be presenting this knowledge capsule on healthcare quality systems. My name is Dr. Sandeep Chalke. I'm a chartered engineering and management consulting professional with 30 years of extensive industry experience. I have functional expertise in strategic management, operational excellence, system analysis and development, management systems and sustainability standards, risk management, technical regulations, conformity assessment, and accreditation. I'm lead auditor for multiple ISO standards and sustainability frameworks. I have helped thousands of organizations around the globe achieving their quality system certification and accreditation requirements. Well, let us set the agenda for this presentation. We will start with the context. After that, we'll have an overview of healthcare quality. Then we will see what are the requirements of ISO 9001:2050 standard. And then we'll go to NABH, National Accreditation Board for Hospitals entry-level standards. After that, we'll see benefits of being a certified or accredited organization. And then we'll see what steps we need to take in order to achieve either certification or accreditation. Let's see, how do we define healthcare quality? By definition, a healthcare organization is a complex organization due to the intangible outcome of service and diverse professional staff. Healthcare quality management is a critical requirement in the healthcare sector. Quality principles have always been implicit in healthcare. However, quality is not a tangible characteristic of a service. By substituting the term quality care service for medical care, the field is further defined and defined as an entity that can be assessed, monitored, and improved. A high quality healthcare system is defined as accessible, appropriate, available, affordable, effective, efficient, integrated, safe, and patient-centered. Quality management is a broad term in healthcare. At first, it was interpreted as instructing healthcare personnel on what to do. However, its current interpretation is that it is used to manage the care processes. It refers to looking at organizational functions as a collection of interdependent processes and procedures that can be addressed individually or collectively. Although numerous models have been proposed, Avedis Donabedium triad of structure, process, and outcome remains the foundation for quality assessment today. By the way, Avedis Donabedium was a healthcare professional from Lebanon. Quality management has become a more pressing need than ever before in the light of new definition of quality that includes patient satisfaction as an outcome of service. The quality of care provided to patients is critical. While the traditional view of quality control focused on defect detection, the current concept emphasizes defect prevention, continuous process improvement, and patient-centered outcome-driven system. As a result, there is an urgent need to effect a paradigm shift in the quality of healthcare delivery. Medicine is a learned professional that determines the quality of its own subject matter. In healthcare, the emphasis is on preventive maintenance rather than total service maintenance. Donabedian proposed evaluating the quality of healthcare using the triad of structure, process, and outcome. The structure component encompasses the infrastructure, the skills and qualifications of healthcare professionals, as well as the administrative systems that support the healthcare delivery. The process encompasses all of the care's constituent components and their interactions. The end result is recovery, re-establishment of function, and survival. To comprehend quality, three critical characteristics must be considered: dependability, assurance, and responsiveness. According to Donabedian, the seven pillars of quality are efficacy, efficiency, optimality, optimality, acceptability, legitimacy, equity, and the cost. Quality services, according to the Institute of Medicine, are those that are safe, effective, patient centered, timely, efficient, and equitable. In healthcare quality management, a paradigm shift has occurred from anticipating errors and defects to believing that perfect patient experience is possible. Philip Crosby, another quality guru, subscribes to the same tenet that the system that generates quality is prevention and not appraisal. According to the literature, medical negligence and nosocomial infections are the leading causes of death for a large number of patients in hospital. These deaths are easily avoidable through the implementation of quality assurance programs. While the system designs are critical, they are insufficient in healthcare management. Clinical care with high value is defined as the most efficient use of resources to achieve an established high level of clinical quality. Patient satisfaction is a desired outcome of quality assurance program, which requires both patient-centered care and adherence to standards and effective protocols. Patient-centered care, as defined by the Institute of Medicine, is a style of care that is respectful of and representative of individual patient preferences, needs, and values, ensuring that the patient values guides all clinical decisions. Another strategy is shared decision making, in which clinicians and patients collaborate to make decisions based on the best available evidence. Patient satisfaction, a model term that lacks a standardized definition, is a multidimensional entity that is highly subjective. The majority of studies examining the complexity of the relationship between the three critical components of service quality have been conducted in developed country settings, which cannot be generalized to developing country like India due to cultural and many other differences. The overall quality of service is a critical factor that patients consider when selecting a healthcare provider. While system designs are critical, they are insufficient in healthcare management. Clinical care with high value is defined as the most efficient use of resources to achieve an established level of clinical quality. In quality management, no single model has been established as superior to others. Any mechanism, any standard, any framework would be effective if top management and the team are committed to quality. There are many quality tools can be used to continually improve the quality management system's effectiveness, which can include internal quality audits, the subject feedback or patient feedback, corrective and preventive actions to ensure compliance with applicable standards. Implementation is facilitated by IT integrated healthcare management information system and committed leadership. The Plan, Do, Check, Act PDCA cycle, alternatively referred as to Deming cycle, quality guru who taught Japanese people about the quality management, is the most widely used tool for the continuous quality improvement. Six Sigma, Lean, total quality management are additional methods. The Kano model can also be used to ascertain patients' needs and to increase patient satisfaction with healthcare services. Internal quality control measures, such as well-defined protocols that adhere to standard operating procedures and continuously trained staff are in place, while accreditation is an external evaluation of quality. That also true for the certification requirements. Now let us see why we should go for healthcare quality management system. There are five factors driving the change in healthcare industry. The first is consumerism and its growing influence. Patients now have far more access to data and are more engaged in determining which care options are best for them and their wallets. They can shop because of price transparency enables them to do so, and the programs that connect and educate consumers are becoming more prevalent. Transition to value-based care. This is the factor most likely to produce immediate and widespread results as the centers for medicine and medical services they push for an alternative payment methods in the program or payment models. The shift could be a result in a new revenue streams for healthcare facilities. Digital transformation. In addition to the widespread adoption of electronic health records, new technologies are transforming how clinicians provide care and how patients interact with the industry. Artificial intelligence programs such as Watson and genomics-based precision medicines are expanding the boundaries of a personalized healthcare. Decentralization of care. According to some reports, remote patient monitoring and virtual clinics bring care directly to patients rather than bringing consumers to the centralized location. This means that the consumers can seek care anywhere and at any time. And finally, the increased emphasis on wellness. According to again reports, this trend benefits patients, insurers, and healthcare employees alike, encouraging patients to eat healthier and exercise more, for example, improves their overall health, and offering wellness programs on site helps reduce employee burnout. Now, let us try to understand what the standard is. The standard is defined as a framework on which you base your management system. It is not designed to replace but enhance the existing one, because I believe that every organization has some sort of a management system in place. It can be on the ad hoc basis, it can be on a repeatable basis, or it can be defined and documented basis. Let's try to understand what is ISO. The International Standard for Quality Management Systems, QMS, called as an ISO 9000, was first published by the International Organization for Standardization. We pronounced it as ISO in 1987. Before it could become an internationally recognized standard, ISO 9000 had to be agreed upon and accepted by majority of ISO member nations. Today, there are more than 165 nations around the world are the members of ISO. The most recent update is ISO 9001-2015, which was launched in September of 2015. Striving toward quality and consumer satisfaction is the mission of every modern organization. ISO 9000 provides a framework on how to achieve this. And the first step in the implementation is to really understand what the standard requires. So further, we are going to see how the top management and the employees in the organization, they can establish and maintain ISO 9000 based quality management system, and we'll try to clear up any misconceptions regarding the standard requirements. ISO 9001-2015 quality management systems requirements. This is the only ISO 9000 standard for which certification can be gained, intended for use in any organization, regardless of size, type, or product or services being provided by that organization. It provides a number of quality management system requirements which an organization needs to fulfill to achieve customer satisfaction. It includes a requirement for continual improvement. ISO 9001-2015 quality management system fundamentals and vocabulary covers the basics of what quality management systems are and also contains the core language of ISO 9000 series of the standards. A guidance document used for reference to understand terms and vocabulary related to quality management system. And finally, ISO 9004-2018 gives the guidelines for enhancing an organization's ability to achieve sustained success. This guidance is consistent with the quality management principles given in ISO 9000-2015. ISO 9004-2018 provides a self-assessment tool to review the extent to which organization has adopted and the concepts in this document. ISO 9004-2018 is applicable to any organization, regardless of its size, type, and activity. So let's see what are the benefits of implementing ISO 9000 for any organization. It aims to provide a practical and workable quality management system for improving and monitoring all areas of your organization. Achieving the ISO 9000 standard is not about establishing set of procedures that are complicated and difficult to manage. The aim is to provide a workable management system that is suitable for your organization. With the right support and the knowledge of your employees, you will end up with a system that will improve all areas of your organization. Implementing an effective and robust ISO 9000 quality management system, we also call it QMS, will help you to focus on the important areas of your business and improve efficiency. The management processes that can be established throughout your organization will provide a sound foundation, leading to increased productivity and profit. This in turn will improve your customer acquisition and retention. Some of the main benefits of ISO 9000 certification includes it is suitable for smaller and larger organizations. You have better internal management, less wastage, increase in efficiency, productivity, and profit. You improve customer retention and acquisition. You can be assured of consistent outcomes which are measured and monitored. It is globally recognized standard and it is compatible with other ISO standards like ISO 14001 Environmental Management System and ISO 45001 Occupational Health and Safety Management System. Many organizations which are environmentally conscious and would like to have control over their occupational health and safety requirements, they also implement integrated management system, which includes ISO 9001, ISO 14001, and ISO 45001. As we have said earlier, ISO 9001:2015 standard is recognized worldwide, and your customers will understand the benefits of working with organizations that are ISO 9000 certified. In fact, many customers would like to approach the organizations, which gives them assurance that your management systems are constantly assessed and approved by an accredited agency. ISO 9000 is based on 7 quality management principles. The first principle is customer focus. The primary focus of quality management is to meet the customer requirement and to strive to exceed customer expectations. This can happen only when you have an able leadership. Leaders at all levels establish unity of purpose and direction and create conditions in which people are engaged in achieving the quality objectives of the organization. The third principle is engagement of people. Any organization, it is not the brick and mortar story. It is not about the building. It is not about the equipments. Any organization is driven by the people. So it is essential for an organization that all people are competent, empowered, and engaged in delivering value. Competent, empowered, and engaged people throughout the organization enhance its capability to create value. The fourth principle is a process approach. Consistent and predictable results are achieved more effectively and efficiently when activities are understood and managed as interrelated processes that function as a coherent system. Principle 5, improvement. Successful organizations have an ongoing focus on continual improvement. 6, evidence-based decision making. Whenever you make a decision, you make sure that you analyze and evaluate the data and information that is more likely to produce desired results. And finally, relationship management. For sustained success, organizations should manage their relationship with all the stakeholders, including their service providers and suppliers. In healthcare, risk management refers to the clinical and administrative systems, processes, and reports that are used to identify, monitor, assess, mitigate, and prevent risk. By implementing risk management, healthcare organizations can protect patient safety while also safeguarding their assets, market share, accreditation and certification, reimbursement levels, brand value, and community standing. Historically, healthcare risk management has been centered on the critical role of patient safety and the prevention of medical errors that jeopardize an organization's ability to accomplish its mission and avoid financial liability. However, as the role of healthcare technologies have expanded, cybersecurity concerns have increased, medical science advances at a breakneck pace, and the regulatory, legal, political, and reimbursement environment has changed constantly. Healthcare risk management has become more complex over the time. ISO 9000 is based on PDCA cycle, as we have seen earlier. It's also known as Deming cycle. The PDCA cycle can be applied not only to the management system as a whole, but as to each individual element to provide an ongoing focus on continuous improvement. Healthcare is frequently an untidy workplace, prone to human error and resource waste. Additionally, it is a field that requires continuous improvement and re-evaluation of the practices used in day-to-day work, which means that a system such as PDCA cycle can be extremely effective at ensuring that the employees' work schedules are always current with the current patient demands and other relevant factors. Hospital work typically occurs in waves due to a variety of environmental factors. And planning for those waves in advance is a significant step towards reducing future workload over the course of facilities' first few weeks of operation. When a hospital keeps meticulous, accurate records of their work for an extended period of time, they should be able to use various statistical analytical tools to forecast when the next spike will occur and allocate resources accordingly. Let's try to see process approach in more detail. Process is defined as set of interrelated or interacting activities that use both tangible and intangible inputs to deliver an intended results. The tangible inputs could be material and equipments, and intangible inputs could be data, information, and knowledge. All organizations use processes to achieve their objectives. The process approach includes establishing these processes to operate as an integrated and unified system and can be applied to any organization and any management system, regardless of type, size, or complexity. Let us now see the process approach fundamentals. The management system integrates processes which it both monitors and measures to achieve objectives. Processes define interrelated activities and checks to deliver intended outputs. Detailed planning and controls are defined and documented as and when required within the context of the organization. In accordance with the requirement of ISO 9000-2015, the sequence of actions provides example of how an organization may choose to build and control the processes of its quality management system. Your organization should follow all steps in the process approach. Performance can then be managed and improved by applying PDCA cycle. In the healthcare industry, the main and supporting processes are medical, pharmacy, meals, laundry, information and communication technology, and infrastructure, and there are many more. ISO 9000 is made up of 10 sections, commonly known as clauses. And those clauses are scope, references, terms and definition, context of the organization, leadership, planning, support, operation, performance evaluation, and improvement. In conclusion, certification to ISO 9000 demonstrate your organization's ability to meet its customers' requirement and needs. It will assist you in the following ways. Assure the quality and safety of patient care. Recognize and manage risk to patients, employees, and the organization as a whole. Determine, manage, monitor, and improve intricate and interdependent processes. Adhere to applicable international and domestic legal requirements. Establish routines and procedures that adhere to the best practices. Prevent accidents. Identify areas for improvement and ensure that your quality management system is continually improved. Assure patients, authorities, and other stakeholders that your management system is functioning properly and that you are committed to continual improvement. Now let us see about the NABH. NABH stands for National Accreditation Board for Hospitals and Healthcare Providers. And they have the accreditation procedure uh, where they provide the recognition to healthcare organizations. Basically, accreditation is a procedure by which an authorization body gives a formal recognition that the organization is competent to carry out specific tasks. The NABH standards today are, the standards recognized by the healthcare industry. and they are now being adopted by the government and the private hospitals and are applicable to the whole organization. The pre-accreditation entry-level standards of any BHR: access, assessment, and continuity of the care, care of patients, management of medication, patients' rights and education, hospital infection control, continuous quality improvement, responsibilities of management, facility management and safety, human resources management, and information management system. What are the advantages of healthcare quality management system? If we have to see them for the patients will receive services of an international level of quality that has been independently audited. Patients are presented with the means of choosing between competing healthcare service providers. Patients will have more confidence in the services offered by the organization. For the employees will have better understanding of their roles and responsibilities and objectives from the documented management systems. They will have benefit from reduced stress levels by using efficient management systems and clarity of roles and responsibilities. Their moral and sense of pride will rise when they achieve the goal of certification and accreditation of, and of course, patient satisfaction. New staff can be immediately, trained. They can learn their jobs because everything is in writing. So again, let us try to see the overall advantages of, ISO 9000 quality management system. 2015, it's not 2008, 2015, and the other accreditation. It lowers cost and leads to cost saving. It improves patient satisfaction. It focuses on patient care, satisfaction, and safety. Uh, it helps you develop best practices with reference to supporting documentation. Ensure everyone in the organization are moving in the same direction. Ensure conformance to and effectiveness of the documented processes. You have transparent internal organization that is clear to all employees. It gives you clarity of roles and responsibilities. Now let us see what are the steps which we should take in order to achieve certification or accreditation compliance. So the key steps are: first, we start with the preparation. This is the initial phase. Now, in this phase, we should include getting a thorough understanding of what the standard is and what it entails. This phase may involve appointing a project champion among the senior leaders. In addition, it is critical that senior leadership is on board and fully aware of the commitment and importance. Then we move on to gap analysis. Here we conduct thorough review of our all existing quality policies, protocols, tools, and needs. This will this will help inform our responses to standards requirements and will form the basis for the core element of our solution and how we are going to structure our quality management system. Next, we assemble the team. It is smart to create a project team and the leader that are well informed about your operations and quality management system. After that, we'll define the scope, context, and objective. Here, the team will create documents that define the scope of the project and any organizational context, such as the historical approach, the patient needs, the regulatory mandates, and the stakeholders. After that, we'll have the risk assessment. A risk assessment plan is a component of any ISO process. The process needs to be outlined and the data, results, and analysis must be recorded. After that, we'll control the risk to the quality. Once the risks have been identified, the organization needs to plan for each one and treat and tolerate, terminate and transfer the risk. These decisions need to be documented and reviewed with the certification or accreditation auditor. After that, we train our employees. They need to understand the importance of the certification or accreditation, and they have to be trained in quality and its importance. Then we move on to the review and update. We'll check our documentation to ensure that all of policies, processes, and procedures in the quality management system are well formatted, correctly formatted, and meet the requirement of the standards and framework. The internal audit and the metric certification. Now here the certification requires the internal audit at plants intervals. It is necessary for us to establish the measurements and the monitor systems and review the results. And once we are confident that our system is matured enough, we can approach the certification and accreditation body to follow their own procedures. So they come and audit our quality management system so that our organization can be certified or accredited. So what is a remote ISO implementation and auditing? A remote management system implementation and audit, also known as e-implementation and audit, is exactly the same as an implementation audit audit, but by using electronic means to remotely deliver the training, guidance, consultancy, and obtain audit evidence and evaluate it objectively in order to determine the extent of conformity to the audit criteria. Remote intervention techniques are similar to those used in person, but for instance, you can share a file via email, Google Drive, Box. In addition, the organization can provide the documents by sharing its desktop screen or via video conference using Skype, Zoom, or Microsoft Teams or Google Meets, etc., which is also used for interviews together with a phone. Surprisingly, reviewing documents records virtually can be even more effective than doing on site. Some areas might present difficulties during the remote interventions. However, we can always use the live video and other surveillance techniques to exchange necessary information. Remote audit methods are already mentioned in ISO 19011 guideline for auditing management system. And according to the standard, the nature and the scope of the remote auditing methodology may differ. I prefer to use the remote techniques personally because I think in this difficult time of COVID-19, it is good for all of us that we less travel, we less interact with people, we maintain the social distancing, and personally, I've been using this technique for past almost 1.5 years. Ever since the outbreak of the pandemic, and ever since we have rendered our services to organizations all around the globe remotely, and we find that they are not only happy but they are very delighted to receive the service because it definitely saves time and money as we use technology. It avoids traveling to, either it's traveling itself is difficult nowadays. The logistics related to auditing are or whenever the management consultant visits, they are not needed anymore, and the audit team and the auditor team can be more efficient. So what we do is that we use the computer assisted techniques. We use telephone and video conference. We have an interactive web-based communication. We'll have remote access to documentation of the management system and its processes. And basically, digital consultancy interventions and audits are mixed with reality solutions. Uh, for examples, we can use the virtual reality web applications too. So remote interventions have come to stay. Their advantages are unquestionable over the traditional methods, although there are still some barriers to overcome. The traditional consulting, training, and audits, even when they have been well planned and executed, may cause a certain amount of inconvenience and disruptions to the organization. In addition, business managers are increasingly finding these interventions very attractive since reduction in cost and resources are undeniable using virtual methodologies. Also, remote interventions are an alternative for more efficient and productive methods of ISO training, consulting, and certification, not only from the point of view of your organization, but the employees as well. Now, many organizations, before they go for certification and accreditation, they would like to know, how much the whole thing is going to cost them. So one needs to consider the cost and project length, which are further influenced by the detailed understanding of the implementation phases. Any cost is painful in tough economic times. An organization that want to reduce cost without compromising on quality are looking at ISO. So implementation costs are driven by perception of risk and how much risk an organization is prepared to accept. Four cost needs to be considered when implementing this type of projects. The internal resources. This the system covers wide range of business functions, including management, human resources, information technology, your healthcare facilities, and the quality management system. These resources will be required during the implementation of the quality management. External resources, experienced consultants will save huge amount of time and cost. They will also prove useful during internal audits and ensure smooth transition towards certification and accreditation. Of course, certification and accreditation cost. So there are few approved certification agency who can assess organizations against ISO 9001, and their fees varies from one certification body to another certification body. And finally, an implementation cost. This cost depends largely on the baseline quality management practices available within the organization. So on average, implementation of a system such as this can take anywhere between 4 to 12 months and depends largely on the standard of conduct and quality practices and management support, the tone at the top, the size and the nature of the organization, the maturity of quality practices within the organization, and existing documentation as far as the processes and procedures are concerned. So now we have come to the end of this presentation. In case you require further information, I'm available at sandeep.chalke at isomantra.com, or my WhatsApp number is 91842590 665. So please get in touch with me in case you would like to discuss your specific requirement. Thank you very much. Have a good day and stay safe.